Good afternoon, everyone, and a Happy New Year. Welcome to the International Media Briefing brought to you by the COVID-19 National Task Force and the Jakarta Foreign Correspondents Club. It is a pleasure to have all of you with us today. In the next hour, we will be answering your questions relating to the Indonesian vaccine program and overall efforts pertaining to COVID-19 management in the country. We encourage you to ask your questions via the chat feature for us to answer following the end of the first Q&A session, moderated by Mr. Edward Davis, President of the Jakarta Foreign Correspondents Club. Without further ado, let us welcome Professor Wiku Adisasmito, the official spokesperson for the COVID-19 National Task Force, to give his opening remarks. Over to you, Professor.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, Bapak Edward Davis, the President of the Jakarta Foreign Correspondents Club, members of the JFCC and the international press, friends and colleagues. First of all, I'd like to extend a warm welcome to all of you today. I would like also to express my sincerest gratitude to JFCC for hosting this event. Nearly a year has passed since the outbreak of the COVID-19 pandemic, and much progress has been made in its management. While it has been an incredibly challenging journey for us, there have also been several glimmers of hope. Let me start by updating you on COVID-19 cases in Indonesia as of this week. Currently, we rank 20th out of 216 countries in terms of recovery rates. And we continue to be one of the few countries with consistently high recovery rates, and will ensure that this trend continues moving forward. Next, allow me to summarize the Indonesian government effort in managing COVID-19 since our last briefing. Indonesia, as you may know, has received 3 million ready-to-use dosages and 15 million bulk dosages of Sinovac vaccines. The government of Indonesia is currently procuring the following vaccines: the Novavax of 50 million dosages, and AstraZeneca 50 million dosages, Pfizer 50 million dosages, and COVAX Gavi is 54 million dosages. The Sinovac vaccine with 65.3% efficacy has obtained AUA from the Indonesian FDA. At present, our primary objective is ensuring that at least 70% of the Indonesians are vaccinated in the next 15 months. Nevertheless, behavioral change and adhering to health protocols will continue to be promoted extensively, as we still believe that there are important preventive measures to decelerate COVID-19 transmission. Moreover, we will continue to increase our efforts in suppressing transmission through contact tracing and also quarantining efforts. The government at all levels, police, military, and also community organizations are working very hard to improve surveillance and also contact tracing system to ensure no new further case emerge. For the government of Indonesia, our people's lives are and will always be the #1 priority. All our efforts are aimed at saving as many lives as possible, especially those at the front line. 2020 was a difficult year for most of us, yet we remain resilient. This year, armed with wisdom and optimism, we will strive to become a stronger nation and fight the pandemic. Once again, thank you for joining me today. Without further ado, I will now answer some of the questions from the media.
Thank you, Professor. There are several questions here that has been submitted previously by our media friends. The first question coming from Victoria Milko, the Associated Press. For efficacy data, can you please provide information on the following? First, total number enrolled in vaccine and placebo groups. Second, total number of infections in each group. And the third, how many of those were severe in each group? Thank you.
Thank you, Associated Press. So we cannot provide specific data at this moment. However, we can inform you that there were 1,600 individuals that were enrolled in these trials. Should you need specific answers about it, I would like to direct you to Indonesian FDA or BPOM, who has the authority to speak regarding this matter in greater details. Thank you.
Professor, second question still coming from the Associated Press. What difficulties are expected regarding the rollout of the vaccine, and what are the plans for how these issues will be addressed?
The greatest challenge is Indonesia's vast geographical landscape, of course. However, to address this possible challenge, we are working closely with the military, police, and also other levels of the government to ensure smoother vaccine distribution.
Thank you. And next question will be, does Indonesia currently have enough support materials, such as syringes, needles, etc., to support the COVID-19 vaccine rollout? Should we expect shortages at any point?
The task force and the Ministry of Industry is working closely with the Indonesian health equipment industry to ensure supplies of these necessary materials, and thus, at present, we do not foresee any possible shortages.
Thank you, Professor. Next question. What steps are being taken to address vaccine hesitancy in communities across the country?
Thank you. From the very beginning, we have emphasized on educating the public in dealing with this pandemic. Campaigns with regards to vaccinations are undoubtedly underway. Nevertheless, despite the vaccination program, we will continue to prioritize behavioral change in the public with regards to health protocols and overall disciplines.
Thank you, Professor. Last question from the Associated Press. Cases are still rising, and the delivery of a vaccine will not prevent the spread of infection in the general population for some time still. How is the government working to control the spread of the virus? Thank you.
Thank you. Despite the vaccine rollout, we will not stop encouraging the public to adhere to health protocols, including wearing masks and self-isolations if necessary. Most recently, the government has restricted activity as stipulated in the instruction of the Ministry of Home Affairs, number 1, year 2021, which also requires regional governments in red zones to restrict the community activities through derivative regional regulations tailored to the needs of each region. In addition, the Central Task Force encourages the activations of POSCOs or central command at each level to the micro level at the households, and has even provided flexibility to the use of the village budget to run this program. Thank you.
Thank you, Professor. The next set of questions coming from Mr. Edward Davis, Reuters. Given that the government appears to be placing a large emphasis on the vaccination program, can you comment on the Brazilian trials that indicate the Sinovac vaccine is only 50.4% effective?
Thank you, Reuters. We continue to monitor the vaccine development globally, especially those that are undergoing clinical trials. According to the Science article that the 50.34% efficacy is a result of a more detailed analysis that included trial participants who tested positive but had mild symptoms that did not require medical help. It found that 167 cases of COVID-19 in the placebo group and in 85 people who received the vaccines.
Thank you, Professor. Still a question from Reuters. Can you comment on the decision to ban foreign entrants for another 2 weeks in a bid to stem new variants of the virus, since foreign tourists are already barred and this does not seem to apply to Indonesians or foreigners holding a valid visa? How will this cut the risk for people bringing the new variant? Thank you.
The government has issued regulations which aim to prevent high mobility of people coming to curb the rise of the newly imported cases. And this regulation stipulated that any entrance into Indonesia should be accompanied by a 5-day quarantine and at least 3 times negative PCR test results within that period.
Thank you, Professor. The next question is from Lucy Godu, Agence France Presse. Will older people be included in a later phase of the campaign in view of the results of the phase 3 trials in Bandung?
Thank you, Agence France Presse. Vaccines have specific target audiences, and vaccines directed at the aging populations need further development. We want to make sure it's safe. Nevertheless, the government commits to expanding the scope of the vaccination program. Thank you.
Okay, Professor. This will be the last set of questions for our prepared Q&A session. Afterwards, we will be giving the time for the moderator to conduct the Q&A session. So the last question is from Wahyudi Suryatmaja from Straits Times. Is there any Bandung clinical trial participant who was with symptomatic COVID-19 but were not PCR confirmed? How many of the suspected but unconfirmed COVID-19 are there in the overall study population? How many of them in the vaccine group and in the placebo group? Thank you.
Thank you, the Straits Times. So all subjects who had COVID-19 symptoms 14 days after the second injections were subjected to a PCR examination. If positive, they were later included in the case calculation. And calculations of the efficacy using the annual incidence rate in the vaccines group of 7 people compared to the placebo group of 18 people. And the efficacy obtained was 65.3%. Thank you. So next, please, Mr. Edward, David.
Okay, well, thank you very much and good to see you again. It's great to have you at this time, just as the vaccination program is starting. And while at the same time, there have also been new record daily tolls for cases and deaths, unfortunately. So let's just looking at some of the questions. We do have a question from the Belgium embassy, Sarah Gerard, who is asking, saying there's been some criticism that the data in the 3rd clinical trial for Sinovac vaccine in Indonesia has not been transparently released, and which is there a risk this could undermine public trust in the vaccine? Will this still be done? Will you release more information?
Yes, thank you. I understand that there are many issues related to the clinical trials, the 3rd clinical trials, I'm sure everywhere in the world, including the one in Indonesia. And the Indonesian FDA, the Faculty of Medicines at Pajajaran University, as well as Bio Farma, are working together to make sure that all of the clinical trials run very well. And they communicate each other and they share the information and data. And of course, those informations are open for public. And therefore, when the Indonesian FDA, the BPOM, informed about EUA, of course, mentioned about the result of the clinical trials in Indonesia. And for the justifications of the results, of course, that will be published later in the scientific journals. But the discussions among experts in Indonesia involved in the government as well has been very active about this clinical trials and also all of about the vaccinations program. So we hope that with the transparency that we have, the discussions, and sometimes because this issues is very technical and scientific, and not many of public understand that. So that's why the gap that we have between the scientists, the government, and the general public need to be worked out to make sure that the understanding received by the public, because this vaccinations program is important for the public. Thank you.
Okay, thank you. A question from Aris Aditya at Bloomberg News. Which vaccine will Indonesia receive or take from Gavi? And Gavi is the alliance with the WHO, I believe, and COVAX. So which vaccine will Indonesia receive or take from Gavi?
Okay, thank you from Bloomberg News. As far as we know, that from the Gavi, they have like 3 vaccines, which is Pfizer, Moderna, and also AstraZeneca. And the details about when they will arrive, of course, will be informed later. Thank you.
Okay, a question from Natalia at AFR. An epidemiologist said that with an efficacy of about 50%, it's impossible to reach herd immunity unless you vaccinate 100% of the population. What is the government's response to this matter? And are you still hoping to achieve herd immunity?
Thank you. The questions from AFR. So that we have to know that now we are facing with the pandemic with COVID-19, and all of the countries are trying to find the way to prevent of getting infected by the COVID-19 for their people. So efforts to have protections and not necessarily only to have vaccinations is the only one. The health protocols is one of the first important protector or shields for the public, and vaccinations is coming the second to improve and strengthen the ability of the people to prevent of getting infected. And we receive the recommendations from the WHO that the efficacy above 50% is acceptable. And we know the lower efficacy, of course, the number of the people that will be vaccinated will be more. And I think that's the challenge for many countries in the world, including Indonesia. So we will work out on that and make sure that the validations of the results, trials, and including the variety of the vaccines that will be used in any country will be successful in terms of making the herd immunity in the country. Thank you.
Thank you. And a particularly important question for this particular audience. How do resident foreigners fit into the vaccination schedule? This is from Robert Nasi at C4.
Yes, I'm sure this is an important issue arise everywhere in the world, since we are like in a global community and we share people living in other countries, and we want, of course, to protect all people who reside in Indonesia, in this country, and vice versa for other countries as well. But we want to make sure that our people are protected and all the foreigners also coming, that they also will be protected. But of course, there are some priority when we deal with the vaccination schedules in terms of the targets. So of course, first is the high-risk groups, which is the medical personnel who deal with the patients, and also the public workers, and then the elderly, and then the rest of the populations. And of course, foreigners are part of the public general populations. Thank you.
So it will be free for them?
We don't know yet. but probably it will not be free because what has been said by the president is free for the Indonesians. Thank you.
Right. Okay. A follow-up question from Anya at Agence France Presse. This is a very interesting question, I think, talking about the new COVID variants. I think, the UK variant, South African variant, which I believe the UK variant has been detected in the Philippines. Does Indonesia, what measures is Indonesia taking to respond to this finding? And does Indonesia have the capacity to detect these variants?
Yes, thank you. This is an important question, and I think all countries are, they have to deal with this issue. And we also access the database, the international database, through the GSAID, where we can see the distributions of the variants of COVID-19 or coronavirus everywhere in the world, including the report from the adjacent countries or in these regions, and also Indonesia. And with the latest development that we see that, now we are trying to collect also more rigorously from sites in Indonesia, across Indonesia, from the hospitals, from the patients that are hospitalized, and then analyze it in the laboratory at the National Institute of Health Research and Development in the Ministry of Health, as well as at the Ekman Institute in Jakarta. And we hope that we can read the distributions of the strain viruses in Indonesia. Thank you.
Okay, perhaps come back to AFR since I think they've had, but there's another follow-up on the clinical trial in Bandung. 800 people got the COVID vaccine, 800 people placebo. What will happen to the 800 people who receive placebo? Will they be a priority for COVID vaccination? Interesting question.
Yeah, thank you. So of course, for the people who are volunteer to be part of the clinical trials and receive the placebo, we want to make sure that for those who are in the placebo group are the people without getting any vaccinations. Of course, those people will be part of the general publics that will be vaccinated later. Thank you.
Okay. Question from Anne Barker at ABC. There does seem to be some confusion over the priority Indonesia is giving to vaccinating the elderly first or working age people. Has this priority changed at all? A table released earlier this month suggested the elderly people were in wave 1 for vaccination after health workers, but there is no vaccine available yet for older people. Can you explain how this is going to progress?
Yes, we understand that there are many groups in the populations that at high risk, including the elderly and health workers as well, and public workers as well. So that's why we have to make sure that the schedules are followed each other, and with the vaccines that will be obtained from various different vaccines producers, we can support to provide the risk groups, including the elderly. We understand the availability of the vaccines in the world are not sufficient to cover everyone in the world. So that's why we want to make sure that the priority are enforced when we implement the vaccinations. Thank you.
Thank you. A question from Stephanie Jürgen from the German Embassy. How do you plan to ensure the cold chain during the vaccine rollout, especially in the rural areas of Indonesia?
Yeah. Indonesia has been familiar with the infectious disease for a long time, and vaccinations is part of our programs. So therefore, our cold chain network in Indonesia has reached to not only to the cities, but also to the rural areas, the urban and the rural areas. So we are using the mechanisms to reach out the rural areas to make sure that the COVID vaccinations will use the same distribution and cold chain network.
But I presume it would be difficult if you did have the Pfizer vaccine to distribute that in outside some of the major cities.
Sure, of course. And of course, we have to make sure that the requirements of the vaccines and to have the specific cold chain met, which means that, of course, it will be in the big cities probably if we want to use the vaccines that need much lower temperature.
Right. Okay, a question from Vidya Panna at the Swiss Embassy. What was the consideration process in determining the different order proportions of the different vaccines? You've got a kind of large proportion of Sinovac compared with other types of vaccine, other brands of vaccine. What was the strategy, the thinking?
Yeah, thank you from the Swiss Embassy. Of course, we consider several different important things. And one of them is the vaccine's availability. And we want to make sure that we can access the soonest possible, the highest number that we can have, and affordable one, of course, later in the considerations. So that's why it's going to be a mix of different vaccines. Very obvious. Why? Because the availability of the vaccines in the world is also limited. So that's why, that's what we consider in terms of the vaccines available now. Thank you.
Okay, a question from Ji Zhang. There are some people, even officials, I think, who are refusing vaccination. How do you persuade them to join the vaccine plan? And where do these opposition voices, where are they coming from? And how can the central government deal with this?
Yeah, thank you for these questions. I think this is very relevant to all countries in the world since we are facing the same challenge that a new thing happening and people are not ready because they don't understand what's going on and why it's going to be vaccinated as one of the intervention. So that's why we need to have public educations more and more and more consistently and at different levels, and it has to be efficient to make sure that the general publics, and depending on the variations or distributions of the level of knowledge, culture, etc., are understood by the programmers. So that's why we do our best effort to make sure that people understand and know that to protect the whole populations, the whole society, we need to have the herd immunity. Of course, it's a very challenging one to explain about herd immunity to the general publics, especially at the rural area. But with the consistent cultural approach, with the right language, we can convince them. And if you ask me where the opposition's voices come from, apparently the opposition's voices are also coming from the educated groups as well. But they need to know more and being convinced about the vaccinations, the importance of the vaccinations, and even they want to know more about the more technical and scientific terminology. So that's our challenge, and also the expert challenge to convert the very scientific evidences and text into a very layman language so that can be understood by the general public. Thank you.
And just to follow up on that, I mean, I know Sinovac has been deemed halal, but if a vaccine is not deemed halal, do you foresee a lot of issues using it in Indonesia?
It has to be halal for the vaccines to be used in Indonesia because that's the general consensus in Indonesia because of the Muslim country. So, of course, we want to make sure that the vaccines available, even the vaccines that are being developed in Indonesia, should be halal. Thank you.
Okay. And there was just a quick follow-up that's sort of related to this from Sarah at the Belgium Embassy saying, I think she's referring to a statement from the Vice Governor of Jakarta that people who refuse to be vaccinated would be fined. Is that something that the task force is looking at or is an option?
Yes, we understand that. There are many conventional ways to address the issue of accepting or refusing the vaccinations. But then before we issuing sanction or penalties, we have to make people understand, because this is the key issues rather than more on sanctioning. We have to make them understand. Why? Because the first important one is to make sure that if we want to protect the society, we need to reach the herd immunity. So that's why we need to explain about the herd immunity, why it is important, because if we are vaccinated, not necessarily that we can protect the others if it doesn't reach the herd immunity. And vice versa, if this vaccine will be effective to us as an individual, that not necessarily will be 100% effective, because as we are learning and in progress, we see that there is a reinfection, etc. So that's why there are things that we need to learn, and we have to make sure that the public also understand about the situation so that they can accept that vaccinations is part of their effort to protect the nations, including themselves.
Great, thank you. A quick follow-up from AFR on, will the number of people vaccinated be announced? I mean, I suppose every day you're announcing the number of tests, etc. Is there any plan for the number of vaccinations to be announced?
It will be, because it's inevitable that we need to announce so that people can calculate as well how many of us or those that will be vaccinated. Yes.
Okay. Follow-up from Victoria at AP. Will the TNI be involved in vaccine distribution, and if so, how? Can you give an example of the role that they could play?
Yes. We are involving not only TNI, but also police in the vaccination distributions and protecting the system and also the implementations of the vaccinations. And one of the examples is when we distribute the vaccines to the remote areas, for example, we also rely on the armed forces to deliver that, to make sure that it will arrive in due time. Thank you.
Okay. From Amanda Hodge at the Australian newspaper, can those who pay for the vaccine choose which one they receive in Indonesia? I think this is a very interesting question, which again is global, but it's, will that be a possibility for people?
Yes, I understand about this issue. The government policy is to provide the vaccines free for the public, but about whether it's free or charged is one thing. But we have to understand the availability of the vaccines is limited. If we have money, if the funds is available, that doesn't mean that everybody in the world can access the vaccine. So that's why we want to make sure that the people in Indonesia will be vaccinated with the available and acceptable and good quality of the vaccines available for the Indonesia. So the issue is not about the ability to purchase the vaccines, but to make sure that we can access the good quality of the vaccines in due time. Thank you.
But if somebody found a supplier abroad or something, would they be allowed to import the vaccine right now?
Of course, we have some list of priorities. And if the government of Indonesia can have more access to the other type of vaccines, of course, the government of Indonesia will access that for the people. So the effort doesn't have to be individuals, but it's collective by the government. And
I just wondered if the private sector was offering to help, maybe.
Private sector is part of the Indonesians, and they can work together with the government.
Okay. A question from Ismira Lutfia at Arab News. Is the government still confident with its communication strategy to promote vaccination by involving celebrities and influencers. And you're referring to a situation with Raffi Ahmad, which I think went a bit viral after his vaccination. I think there was some pictures of him partying or something, but yeah. So are you happy with this strategy of involving celebrities and influencers?
Yeah, of course, we have to be mindful with all possible incidents when we have, a big programs like vaccinations. And we hope with the big influencer like Raffi Ahmad, we hope that he can play a pivotal role to make sure that the young people will support the vaccinations. And things can happen, a glitch can happen. And of course, it has been clarified by himself. And of course, in the future, when we have more people vaccinated, including influencers, we have to work together in a communication strategy so that it can be carefully, adopted by them and also understood by the followers. But that, this is an important policy by the Indonesian government for all people. Thank you for the questions.
Thank you. And just a question from Sil, I'm not sure where they're from, but what other brands of when the other brands of vaccines are available, will the government give flexibility for people to choose the brand that they're getting?
I guess I already answered that. So we have best vaccines available.
Yeah, okay. And there's a question from Robert Nasir at CIFOR again. What's the actual process to register to get a vaccination? Do you have to register?
Yes, of course. We want to make sure that the vaccines developed in the world also recognized or registered, to WHO, and then the process of the vaccine development is also transparent to public. And of course,
I think it means just to, if an individual wants to get vaccination, how do they have to register as a person?
Yeah, of course. Yeah, they have to register in a system because we have a digital systems in the government of Indonesia working with the state-owned company and to make sure that all of the people are registered. And one of the examples is myself. I received a message in my text that I will be vaccinated in where, and it just follow that and we can get the results, the card, etc.
Okay. And another follow-up from Natalia. Do people who are going to be vaccinated have to be tested COVID-free first? And what would be the effect of people who don't know they've been exposed to COVID get vaccinated? That's an interesting question.
So of course, the people that will be vaccinated has to be tested, PCR, that is COVID-free. And then if they don't know and have exposed to COVID, get vaccinated or not, of course, it will be tested first. And then if we know if it's positive, then probably it will not be vaccinated.
Okay. I think you've already answered the question on Raffi. So just from Amanda, again, you say public health measures are more important even than vaccination. But what do you say to criticism? The government words do not match its deeds and that its latest restrictions are not serious, i.e. reducing mall hours by just 3 hours, while at the same time allowing domestic airlines to fly at 100% capacity?
Yes, we understand that there are mixed probably signals, but we want to make sure that our communications to public and also the compliance of the public to the government announcement, regulations need to be improved from time to time. But this is in the pandemic era, we are challenged everywhere in the world, of course, and we have to improve from time to time. Thank you.
Okay, from Trier Dianati at Wanaichi Shimbun. So how many years will it take to vaccinate all the people in Indonesia? I'm going to follow up any possibility of a paid vaccine.
Yes, it's challenging questions, not only to Indonesian, I guess, to every countries in the world. Right now, as far as we know, there are 11 billion people that need to be vaccinated, and only 6 billion vaccines probably available to support, including Indonesia is part of that. And in order to vaccinate or to cover the vaccinations target in Indonesia, it takes time. But in terms of ability to vaccinate, according to the Minister of Health, it takes about 8 months in terms of the capacity to vaccinate the infrastructure. However, it takes longer to get the vaccines available. So that's why the estimation at this moment, it will take about 15 months. And of course, the time cannot be fixed because the development always improve from time to time. So at this moment, that's the situation.
Okay. And a question from Wayudi at Straits Times. Can you confirm Indonesia is doing pay your own vaccination Mandiri program, and when would this start? And would people be free to choose which vaccine or government pick based on profile or age?
Up to this point, we don't have the Mandiri program, and we will measure the situations. Of course, the Mandiri program will be available when the vaccines availability in the world improve much, including the vaccines that are produced by the Indonesians.
Okay. And just to follow up from Amanda on this, just whether private individuals or companies will not be able to import a specific vaccine for their own employees.
I think if the private companies can import the specific vaccines in high numbers, of course the government will import that first, because the private individuals or companies are part of the Indonesians, because the government is trying to do our best to cover all members, regardless whether they are public servants or working at the companies.
And if a particular business wanted to offer to organize its own vaccination for its staff, would that be allowed? Or would that not go outside the current system?
I think if all of the private companies and individuals can organize themselves to import the vaccines, of course the government will also join that. So that's why this is a joint effort. This is not a competition between groups in Indonesia, because the vaccines available in the world is so limited.
Right. Okay. Just a couple of follow-ups about the specific ways that if you're not a civil servant, will you receive an SMS that tells you you're eligible for vaccination?
Of course, some of the non-civil servant or the general public also receive SMS, as far as I know. And of course, that means that they are eligible for the vaccinations.
Okay. And just a follow up from Stephanie at the German Embassy on the saying that foreigners might have to pay for the vaccine. I mean, how about foreigners that are covered by the BPJS health insurance?
We have not discussed in details about the relations between the foreigners and how they will be covered or be paid for their vaccines and its connections with the BPJS or other scheme. But of course, this will be dealt later.
Okay, and a follow-up from Victoria, just how is the 15% wastage rate for the vaccine calculated? Is this an average wastage rate for Indonesian vaccination efforts?
Yes, this is part. It's drawn from the experience from the previous vaccinations program in Indonesia.
Okay, I just had a quick question on the hospital system, how it's coping right now in hotspots in particular. I mean, I've heard Banten, maybe it's quite stretched. Do you have updated any information on how hospitals are faring?
Yeah. The bed occupancy rate for the isolation room as well as the ICU are becoming limited, and it's above 80% at this moment. So that's why the government of Indonesia implement a stricter policy, at least in areas or provinces in Java and also Bali, as they contribute more than about 60% of cases in Indonesia. So therefore, hopefully the pressure to the health systems, to the hospitals bed will be reduced in the near future. And we will see the development closely every day. And we want to stop the pressure to the health systems by more rigorous health campaign, health protocols campaign to the public. So we cannot provide more resources in the healthcare systems with the problems like pandemic, like COVID-19. So that's why prevention is much more important than curative. Although we want to make sure that people who are sick are well treated. Thank you.
Okay, and just to follow up from Amanda at the Australian, given concerns over Sinovac efficacy, will people be allowed to refuse Sinovac and asked to be put on a kind of waiting list, I suppose, for another vaccine that might be more effective?
Yeah, logically, that sounds right. But when we are dealing with the pandemic, we are dealing with the virus, we are not dealing with the government policy. And the government policy really want to protect the people. And sometimes, or most of the time when it's not in the pandemic, we have choices. But in the pandemic, we don't have much choice. And we want to make sure that they understand that we have to move forward because we want to run our life collectively. And that's why herd immunity is so important in the vaccinations program to be understood by them.
Thank you. And just to follow up from Natalia, just with the increasing number of cases and shortage of beds, is the government planning to build a special COVID hospital or another COVID hospital, I suppose?
Yes, of course, we are trying to expand the referral hospitals for COVID-19. But as I said, we cannot have more and more beds provided for the COVID-19 as a referral hospitals because we are not dealing only with the COVID-19 in the Indonesia. We have other health problems in Indonesia. So that's therefore the best solution is not only providing more beds, but we have to have more rigorous and strong, effective prevention programs, which is health protocols adopted by the people with the different approach and cultures in Indonesia. Thank you.
Okay, well, thank you very much for being very open today and on this important issue. And we'll be looking forward, I'm sure, to having you again in not too long. We've also, just for our other members, we're also having Sri Mulyani will be speaking to us on Thursday, the 21st of January. So obviously she'll be very focused on the economic impact of the pandemic. But I'd like to thank you very much, Professor Wiku, for your time today.
Okay, thank you, Mr. Edward Davis, the president of the Jakarta Foreign Correspondent Club, and all of the correspondents and international media for the sessions. I appreciate that we can have interactive conversations and fulfill of the informations that you require. Thank you.
Thank you. Thanks everyone else. Happy New Year.
Thank you. You too.
See you soon.
Thank you.
Thank you, Professor Wiku and Mr. Davis. That was an insightful session indeed. We hope that the event was able to convey our efforts in managing this pandemic in the country, especially our vaccine procurement and distribution efforts. With this, we bring our briefing to a close. Stay safe, stay healthy, and until we meet again.
Tidur